Hello, everyone. Okay. All right. Good evening, everyone. You're welcome to our live session. Like you all know, if you're meeting me for the first time, my name is Dr. Shamsia Aliyu. I am a women's pelvic and obstetric health physiotherapist, and I lead a team and a community of our well-being and care, a space where women actually, it's a safe space where women get to learn about their physical health, their obstetric health and their, pelvic health, and receive solutions to these problems. So today we're going to be talking about real solutions for menstrual disorders. As women, I've interacted with a lot of women, and they usually complain about issues that disturbs them, that they struggle with. And one predominant issue I've seen that is very common among women is actually menstrual disorders. And during our previous live session, we talked about what the different type of menstrual disorders that actually occur in a woman's life. And so today we're going to be talking about solutions to these menstrual disorders. All right, so if you're with me, I'd just like you to make use of the comment section and say hello, how you feeling this evening. I'd like to know how you're feeling and how you're doing today before I share my slides. I'm so happy to have you all. Thank you so much for joining in. And I promise that it's going to be an exciting time of learning. All right. Hello, Chalia. Nice to have you. Nice to have you. Good evening. I hope you can hear me clearly. If you can hear me, just kindly make use of the chat box and say, yes, I can hear you. Good evening. How was your day? Happy to have you tonight. Awesome. Awesome. It's good to know that you're doing fine. Wow, wow. And your week has been good. That's nice to hear. All right, without wasting much time, I'm sure many more others are going to be joining us. I'll be sharing my slide right away so that we get into the discussion of tonight. So, like I said earlier, we're talking about you know, um solutions to menstrual disorders that usually affect women. So during our live session, the previous live session, we talked about the different menstrual disorders that actually affect women. And today we're going to be seeing some of the solutions, specifically physiotherapy solutions that exist for women when it comes to menstrual disorders. So without further much ado, I'm going to be sharing my slides right away. Okay, I'm coming, sharing my share screen. Okay, let me just share my screen. Yeah, so I believe my screen is up. All right, so just like I said, we're actually discussing about solutions for menstrual disorders, right? That are peculiar to us as women. And please, if you have any question, I would just like you to, hold on to your question. And after the session, I will be I will be answering our questions, right? I'll be answering our questions. So just ensure that you came with your questions. All right, so previously we talked about different menstrual disorders that women face. We talked about the premenstrual syndrome, and I made us to understand that premenstrual syndromes are, the symptoms that actually occurs or a woman sees before her menstruation begins. That's before the actual bleeding starts. There are different symptoms she sees. Some it could be acne, some it could be mood swings. You're just wondering why you are in a certain way. Some people, it could be overly excited, some people overly sad, some people can even feel depressed, different type of unusual symptoms, can actually occur, feeling maybe excruciating pains, around your abdominal region, all of these symptoms. So when it happens before the actual menstruation, it's actually premenstrual pain, premenstrual syndrome, right? But when it happens, when the bleeding has actually started, like you started seeing your menstruation, then we call that dysmenorrhea. We said these are the severe pains that a woman experiences, or discomfort that you experience before you actually during your menstruation. So premenstrual syndrome before your menstruation, usually it could be around your cycle, maybe day 16 of your cycle. Remember, I said that a normal cycle length is between 21 days to 35 days. So don't I hope we have not forgotten that. And then so those symptoms that you have during your menstruation is called the dysmenorrhea. And we also said there is a category of disorder that also affects women, which is called amenorrhea. Amenorrhea is absence of menstruation. That is when a young girl is about age 16 and she has not seen her menstruation. Or if you're a young adult or a young lady who has actually started seeing your menstruation, but all of a sudden your menstruation just stopped. And then in after 30 days, the first month you didn't see your menstruation, another month you didn't see your menstruation, another month you didn't see, three consecutive menstrual cycles, then you actually have absent menstruation, and you should not take it lightly. You're expected to go to the hospital and complain to your doctor. Then we have what we call oligomenorrhea. We talked about this is irregular menses, right? With previously normal periods. That means you've had normal periods. And like I said, um, you know, you do not have an irregular menses. For example, the normal menstrual cycle length is between 21 to 35 days. So maybe this month your cycle length was 27 days. Next month is 28 days. The third month is about 30 days. It is still a normal cycle. It is still, you are still having a normal menstrual cycle. Why? Because it falls within the range, which is 21 to 35 days. But you are now having an irregular cycle where maybe this month you have your menstruation occurred after 20 days. Next month, your menstruation occurred after 38 days. The other month, 40 days. You can see that it is outside of the normal range of 21 to 35 days. Then you are actually having an irregular menstrual cycle. And we talked about menorrhagia, which is excessive or prolonged bleeding. In this case, your menstruation is prolonged more than normal. The normal menstrual cycle is between 3 to 7 days, right? You should not bleed more than that. So when you are having abnormally heavy periods, like even in a day, you can soak up to let's say 10 to 15 pads, right? Every hour, every 30 minutes, your pad, your tampons, or whatever it's type of menstrual products you're using is actually full. You're actually having what we call menarche, and you need medical help. And then or a type of bleeding that actually disrupts your normal activities. Anything, any small thing, by the time you sit down your chair, it's so embarrassing and you see blood. It's you're having an excessively heavy period. We also talked about metorrhagia, which is also a type of menorrhagia. We said it's when it is irregular, right, and heavy. But this one is usually between regular menstrual cycle, right? In this type, we said you're having a regular menstrual cycle. It's not irregular, but it is heavy, right? But in menorrhagia, it is heavy, right? But in irregular menstrual cycle. I hope you understand that. So polymenorrhea is when it's very short period, right? Or you're having a period more than once in a month. There are some women who actually have periods twice in a month, and that is also something that needs to be checked. Then we talked about hypomenorrhea, we talked about hypo, right? We talked about um PCOS, right? PCOS is more like a condition that actually causes or leads to irregular menstrual cycle, or menstrual, which is a type of menstrual disorder, right? Now we know that it is usually related to hormones, so we say it's a hormonal disorder, and it's when your ovaries fail to release egg due to numerous small fluid follicles, right? Due to excess maybe insulin, due to hereditary, maybe somebody in your family, your sister, your mother, your grandmother has had this condition, you have the chances of likelihood of actually having PCOS. Is a very common disorder, one of the most common hormonal disorders among women, and it is usually characterized as a result of free, as in little or no menstrual cycle at all. And of course, you know that if a woman does not undergo menstruation, there's no how she will ovulate. And without ovulation, there is not going to be pregnancy. So one of the complications of PCOS is actually infertility, right? I'm sure on one of our live sessions, we're going to be dealing we're going to be talking about PCOS fully, because I know that this is one condition that actually affects a lot of women. So and most times you see that they have very high level of weight, excessive weight. They usually have acne, big pimples all over their face. They are also prone to diabetes. They have hairs because of the presence of excess androgen. Androgen is a male hormone that actually makes women to have excessive hairs on their body. So those are some of the characteristics of PCOS. But like I said, in one of our live sessions, we're going to talk about PCOS as a topic on its own. Yeah, so we also talked about then endometriosis. Endometriosis is a condition where the endometrial tissue is outside the womb. Like the womb, the way the structure is, and so you can see the image on my screen. You can see this is the female reproductive organs. We can see the uterus, which is your womb where a baby grows in. You can see the two fallopian tubes. You can see the ovaries where the egg is being stored, and you can see leading to your vagina. So you can see those these patches, right? On your, it can be on your fallopian tube, it can be on your ovary, it can be on your womb. So those dark patches, they begin to what form as little scar tissues, right? So, and you can only see them by an, as in through an ultrasound. So it begins to cause severe pain and discomfort, and because of this, it can actually lead to a woman having severe painful menstruation. So that's why if you're a woman who experiences severe and painful menstruation, you have to do an ultrasound scan to be sure that there is no, cyst, or there are no scar tissues that are on your womb or on your fallopian tubes or on your ovaries, so that we'll be able to be to screen that out, that it's not that you're actually having endometriosis, because endometriosis can lead to very painful and severe periods. It can lead to, pain when you're urinating. Maybe you're feeling pain, you're having pains when you're urinating, or when you're having intimacy with your spouse, or you notice excessive bleeding, then it's a call for concern, and you should not take it lightly. Ensure the first point of concern is to see your doctor. And if you don't have access to seeing a doctor, you can go to a lab and do an abdominal pelvic ultrasound. And then you give the results to a professional, a doctor, to help you interpret, preferably a gynecologist, and so that you can be referred for the appropriate treatment. And then we have pelvic floor dysfunction. So When you have a pelvic floor dysfunction, like a weak pelvic floor, you understand it can actually lead to chronic or severe menstrual pain, which can lead to spasms of your pelvic floor. So the pelvic floor is a group of muscles that actually keep your pelvic organs in place. Like for your womb to be in place, your intimate areas, your urethra where urine comes out. So the whole of that area, for it to be kept firm and intact, it's determined by a functioning and good pelvic floor muscles. So if you're having severe or chronic menstrual pain, it can actually lead to spasms, around your pelvic floor, which can now result to excessively tight, pelvic floor, which can lead to issues like painful intercourse, vaginismus, which is impenetrable, like difficult penetration, right, for a woman. So these are very important topics that I'm sure we're going to deal um, deeply in our subsequent live sessions. So, going into the discussion for today, so you can see that we talked about different menstrual disorders that can affect a woman, because it's not just having an irregular menstrual cycle, there are other disorders that can happen, and then there are different causes that can lead to these disorders. So, but the good part of it is that there is hope for these disorders, right? So most times when you have these issues and then you go to the hospital, they could just give you a general treatment, like give you pain relief. For example, as a woman, you're having very serious, painful menstruation. When you go to your doctor, the doctor can just give you ibuprofen, right? Can give you pain medications. These are non-steroidal anti-inflammatory drugs. So they help to reduce prostaglandins. And because prostaglandins, they are chemicals that actually what cause womb contractions. So it helps to reduce the production of those prostaglandins. That's these pain medications. And so when you take them, you feel relief. But the other side of drugs is that drugs just give you a temporary relief. So if I were you, wouldn't you want to go for what is more sustainable? Well, I think um that should be a better option, right? So subsequently, we'll be seeing other options apart from just medications, pain relief medications that will be given to you for a temporary relief. Now, hormonal birth control pills. For example, if your doctor has diagnosed you with having a condition like PCOS. Now, PCOS is a hormonal condition, right? Which I'd already talked about earlier. So now your doctor can give you what we call a combined what oral contraceptive. So what it does is that it has both estrogen and progesterone. So it helps to normalize your period, right? It helps to normalize your period. And in the case of PCOS, it can also help to reduce those symptoms that you are having, like acne, like excessive head. It helps, right? And these pills will help to regulate your menstrual cycle. And definitely, you know that when you have a regulated menstrual cycle, you experience ovulation. And with ovulation, you'll be able to track your fertile days, and when you know your fertile days, it will be easy for you to get pregnant if you are an expectant mom. So, yes, like I said earlier, there are different causes of irregular periods. And this is very important because depending on the cause of your irregular period, then you will now know the exact treatment that is needed. Now, if you're having a condition like PCOS, we have been talking about polycystic ovarian syndrome, and we know that it is characterized with just few periods or no periods at all. Too much androgen, we said, is an hormone that causes excessive hairs, and then you see that a woman with PCOS also has acne, and then maybe you have multiple cysts. When they do an ultrasound scan, multiple cysts are being seen, located at the edges of your ovaries, and these are ways. If you have two or more of these symptoms, then it is most likely that you are having what we call PCOS. Now, the complication of PCOS is that it leads to infertility. Because, like I said, as a woman, you cannot be fertile except you have ovulation. Ovulation is the most fertile time of a woman's cycle, where the egg what is being released, where the egg which is matured is being released. So if a sperm come in contact with that egg, it has high chances of getting fertilized to produce a baby. And if not, that's what is being shared out as your menstruation as a woman. So in the case of PCOS, if you know that you've been diagnosed with PCOS, some things that can help use the combined hormonal contraceptives, like I said earlier, because it has a combination of estrogen and progesterone. So this combined pills helps to regulate your menstrual cycle. Then balanced diet, and this way you have to work with a what, a dietitian. You know, the beautiful thing about medicine is that it is interconnected. Nobody is one. For example, I'm a women's pelvic and obstetric health physiotherapist. We have the gynecologist, for example. We have different people who are specialized in different aspects. So it's very important. That's why we're bringing this information to you so that you may should know, you are informed, you know the right care to seek at the right time. So for example, now because you're a PCOS patient and then you work with a gynecologist, you work with a physiotherapist, you work with a nutritionist, you may even work with a psychologist. So there are different medical people that will be combined together to actually help your problem. So don't say, oh no, it's just one doctor wants to see. No, it doesn't work that way. So for example, when your doctor has given you pills, giving your contraceptives, you go to the nutritionist, they give you, a diet plan, how to eat, what not to eat, and then you come to the physiotherapist who will now prescribe the what exercises to you. What are the exercises you're supposed to do that can help to relieve this condition and regulate your menstruation and even your ovulation. So it's very important. Secondly, another cause of irregular period is high prolactin. High prolactin, prolactin is also a hormone. It is responsible for stimulating milk production from your breast. And we know that when we're talking about milk production, it's definitely during pregnancy. So when you're pregnant or when you're breastfeeding, this is the hormone that actually helps you to produce milk. So, and it is also involved in ovulation and reproduction. But when this hormone is excessively high, because for example, if you're not pregnant, if you're not an expectant mother, but you're having high prolactin, is a problem because it can result to you having a tumor in your brain. That's one of the side effects. And then what can you do? In this situation, when this high prolactin level is being detected, then you can now receive treatment, right? Remember, we said because this high prolactin is high, it can affect your what? Your ovulation, it can affect your menstrual cycle. So you need to go and see your doctor so that he can give you medication. And most times, a dopamine and an agonist is being given to you so as to shrink the size of the tumor. That's in the cases of people who has a tumor in their brain as a result of the high prolactin levels. Another cause of irregular periods are the when you are underweight. We always shout, "Oh, obesity! Don't be obese! Don't be overweight." Also, in as much as we don't want you to be overweight or we don't want you to be obese, we also do not want you to be underweight. Underweight is when your BMI, your basal mass index is less than 18, right? We don't want it to be low as that. So when your body fat is too low, it can cause a hormone. Can you see how our bodies, as women, you can't even talk about your reproductive health without talking about hormone, because our life is hormones, right? Different hormones regulate our body, because you're just hearing this hormone, dopamine hormone, prolactin hormone. Now you're hearing leptin hormone. Calm down, you get used to it. So when your body fat is too low, right, it causes a hormone which is called leptin to reduce significantly and makes ovulation to stop. So when your ovulation stop, it can lead to you having what? Irregular period or absent period. I just pray that it's making sense. If it's making sense, you can just put it in the chat box and let me know how you feel about what you're hearing. All right. So Also, now in this case, when you're underweight, what do? You work with your physiotherapist and your dietitian. Your dietitian will help to what? Give you appropriate diet that you need to eat to increase your weight. And then you do what? Exercises that can actually also help you what? Build more muscles and then gain more weight. And then we have what we call premature ovarian insufficiency. So this is when your ovaries have little or no more eggs before your age 40. So this is a condition that also happens to women, when your eggs are finished. Remember, unlike men who reproduce their sperm every day, a woman has a certain number of thousands and millions of eggs that has been given to her from birth. And that's those eggs begin to shed, and to the point where all the eggs are finished. So when those eggs are no more before your age 40, we call it a premature ovarian insufficiency. So normally a woman should enter menopause around 45, 50 years, right? And then some literatures actually say 55 years. And this can actually be treated using a donor egg with IVF. There's a procedure called what? IVF, especially when you have not been able to give birth at age 40. All right, so now having said that, looking at those are the causes of what? Irregular periods and the possible treatments that can be done. Now, secondly, dietary management is very important as a woman who are of reproductive age. So far, you started menstruating right from whether you're 9 years, 10 years, 12 years old. It's very important you watch what you eat, especially during your menstruation. If your menstruation is coming, try to eat light, easily digestible food, and warm foods or even hot foods. It helps to prepare your what? Your uterus, your womb, right? Because a lot is going on during that cycle. In our previous session, we actually talked about it, right? How menstruation occurs, the different cycles, and what have you. So, as your menstruation is coming, and that's why it's very important. As a woman, you should know how to track your menstrual cycle, have a calendar, you know when to expect it so that you begin to prepare. So, before that time, you begin to drink warm water, especially if you're a kind of lady who experiences severe pains, right? Severe cramps during your what? Menstruation. Please drink a lot of warm water instead of cold water. This will help you, right, to reduce those pains that come. It will help you to maintain a normal digestion. It will also help to even improve your appetite and taste. If you're that kind of person that if your menstruation is coming, you lose appetite, you start vomiting, everything doesn't make sense, you don't feel taste in your mouth, please try and um take more warm water often. And then when menstruating, right, that is your menstruation has started now. So what we just talked about was like what you're supposed to eat, the little things that you can take before your menstruation occurs. But when the menstruation has already started, avoid what? Or eating oily food. This is one mistake that a lot of ladies or women make. Avoid eating oily food, avoid eating sugary foods, avoid eating junk foods. It's not that time you should be eating shawarma, it's not that time you should be eating pizza and what have you, junk food, junk snacks. No, eat real foods, right? Avoid deep fried foods, avoid raw foods, avoid burnt food or anything that is heavy. So these things are simple tricks yet very powerful if you can actually, adhere to this daily habits, right? It will help you. So regular meal time. So eat regularly to ensure the previous meal is fully digested. So I always advise that when you're having your menstruation, when you start bleeding, eat little portions, but you can eat at different times. So it helps to aid what? Digestion faster. All right. So when you're started menstruating, you must be very, very conscious about the kind of food you eat. Eat more vegetables, eat more foods that have fibers like oats, right? Like wheat is very important. Eat fruits like avocados, very important. Very, very important. Take a lot of fruits, consume a lot of vegetables, right? And then for women who have PCOS, definitely we know that we said that PCOS is associated with what? Irregular menstruation. And one of the issues that is being associated with women who has PCOS is vitamin D deficiency. So what can you do? As simple as God has given us a natural sunlight. So you go out early in the morning, that first sun that comes out, there is a lot of what? Vitamin D in it. So you get your natural vitamin D from sunlight, and you can get it from food sources like salmon, like mackerel fish, like fish oil. So it's very important that you pay attention to it. And then during your menstrual cycle, during menstruation, there are lots of what? Calcium. You can lose calcium, right? So when calcium is being reduced in your body, right? Um there is it can lead you to having a lot of distress during your menstruation, right? So it's very important that you consume food like dairy products, you eat beans, you eat fish, it will also help you. And then during menstruation, the loss of blood affects your iron level, right? So that's why it's very important. As a woman, folic acid should be your friend. Most times we hear that okay, a woman should just take folic acid 3 months before she's trying to conceive or before she gets pregnant. But aside from just getting pregnant, and so far you are losing blood every month, iron is being lost. And the only way you can replace that iron is by taking what? Folic acid. So I encourage you as a woman, try to take folic acid daily. It helps to restore the iron that you lose in your body. Vitamin C food, is vitamin C should also be consumed, and also eat foods that are rich in what? Poultry, meat, beans, and what have you. So it helps very, very well. All right, so we have what we call, so you can see that we've talked about the different food. So for further information about the right foods to take, please consult with your dietitian. Very, very importantly. Remember, I'm a women's pelvic and obstetric health physiotherapist. All right, so I'm not a nutritionist. All right. So also we have what we call seed cycling. Seeds are so powerful, right? These are natural seeds that can actually be taken for irregular menstrual cycles and some of these issues that women have during pregnancy. For example, research has shown us that there are different seeds like flax seeds, which is very important. It's rich in omega-3 fatty acids, and it helps to what? To reduce painful menstruation. So if you're that kind of woman who has cramps, you know, in your circle, you see, that's why it's very important. Like I said, you cannot survive as a woman without knowing your menstrual cycle. It's very important. So on day 1 to 14, which is the follicular phase. That is when you're expected to take these flax seeds and these pumpkin seeds, right? Flax seeds are high in what? Omega-3 fatty acids, but pumpkin seeds are high in zinc, and each of them have their what? Uses, but both of them majorly they help to what? To reduce inflammation, relax your muscles, and help to reduce cramps. So you see that you don't prepare for a good menstruation when the menstruation starts. Preparation always is better, right? Like the saying goes, prevention is better than cure. It's still the same thing. If you want a better outcome, you must do something different to actually have a better outcome. So we have other seeds that you can take, like sesame seeds, sunflower seeds. They are also good, but this one you take it at the 15 to 28 day of your cycle. So um it can help. They are rich in calcium, magnesium, which helps to reduce cramping during menstruation, right? And also to relax your muscles. And then sunflower seeds, they are rich in vitamin E, so it helps you to produce what? To progesterone and also reduce what? Inflammation and promote your hormone balance. And then it's always important that you talk with a nutritionist so that you can know the appropriate amount to take. But to start with, you can start with as small as 1 to 2 tablespoons of the seeds. You can grind them and eat them fresh daily or at the specific time that you're supposed to take it within your Circle. All right. I hope you're gaining something. I hope you're gaining something. Please put it in the chat box if you're learning something. I'd like to know how you're feeling about the session. I hope you're learning something. All right, so going into physiotherapy management, physiotherapy is a very important aspect of helping with menstrual disorders, and we're going to be seeing some of the powerful things that physiotherapy does in helping to manage what menstrual pain and disorders. So one of the things your physiotherapist will do, which is like my humble self, if you come to me that you have an issue, is first of all counseling, right? Because a lot of menstrual disorders, research has shown that most of them are associated with stress. So the first thing we look at is what is your stress? What is your normal day-to-day life? What is your stress level? Are you excessively stressed? Do you pass through a lot of, stressful activities? Is very important to actually to check all those things, right? So what is your stress level? Will help you to manage your stress. There are different techniques that we can teach you, breathing exercises, meditation exercises, encouraging you to do what you love, and other very powerful interventions that can help you to reduce your stress. You might be surprised that some people their problem with their menstrual cycle is just stress. If their stress life can be managed, I tell you that you'll just notice that their cycle is becoming normal, right? So sometimes as a woman, please try to manage your stress. If the work is too much for you, especially women who have to juggle between their career life, their personal life, their family life, you know, you understand, other aspects of their life, as maybe as parent, as a mother, some at some stages these things can become overwhelming. Learn to delegate, right? And that's why it's very important for you to speak to a professional. You can't do it all. You'll be amazed at some things that you think is so mighty and heavy, that this thing is such a problem. It could just be stress management, and with stress management you are good to go. Then we have another management, which is called electrotherapy management. Now we use TENS therapy. You see, that's why these are things that you cannot do yourself. And that's why you have to speak with a professional. So TENS is called transcutaneous electrical nerve stimulator. So it helps to relieve what painful periods. For example, if a woman who is experiencing excruciating pains during menstruation, dysmenorrhea, right? We already know what that is. TENS can help is a modality that we as physiotherapists use to actually help to manage your pain level, and it works. It works. It works. I've treated a couple of ladies and they have so much possible positive feedbacks to give about their experience, with me treating them with when they had severe menstruation. It helps so much. Then hot packs, or we can say hot towel, right? The use of hot towel, we can see from the picture how the lady is actually placing a pack, we say, right, or a towel on top her tummy. So when you use this hot packs, right? So, but maybe in a some of us may not have access to this. We can take a warm bath. Warm bath is so powerful, And then if you can get like something like a hot towel and put it on the lower part of your stomach for about 1 to 2 hours, right? And then after another period, maybe in the afternoon, you do it again and in the evening. So it helps to reduce the level of pain that you feel. So another very powerful technique is kinesiotherapy. So we call it kinesiotapes. Kinesiotapes can be used to treat menstrual pain. I'm sure you may not have seen this anywhere. Yes, so this is the power of physiotherapy. So you use kinesiotaping. They have elastic properties, right, which helps to lifting the skin, and they give the pain receptors more space, right? So they help. So the stimulus that these tapes actually provide help to what reduce the tissue tension around your abdominal area, and thereby it helps to reduce pain, right, or even eliminates the pain completely. So that's why you can see that you may not be able to do this yourself, and that's why you must speak to your doctor, right? So your physiotherapist doctor will help you to actually relieve your pain using these very unique modalities. And then another one is exercise. Exercise, in fact, the importance of exercise cannot be overemphasized. Exercise is very important, and that's why you should speak with your physiotherapist. She's going to give you um what definite exercises that will help you to relieve your pain. These are some of the exercises that you can do if you're feeling pains. But this is not a one size fits all. And that's why I said you must speak with your physiotherapist. So she will know the exact exercise that you need per time. And by doing these exercises, a lot of women have positive, feedbacks that this has actually helped them to reduce their menstrual problems. This is another form of exercises using the gym balls. We use the gym ball to actually help to strengthen the muscles around your abdomen. So when the muscles around your abdomen, your legs, your arms and back are being strengthened, it can help to improve your balance, your stability and blood supply. And this will actually help to reduce your menstrual pain. We also have this type of exercises. So you see, these are not exercises you just go to the internet and then you just see it because it feels good or because it looks like it. No, you must be working directly with your physiotherapist because based on your unique condition, he or she knows the exact um exercise that will be helpful to you. So these are just basics, right? These are just basics for the sake of what awareness, but you should always consult with your physiotherapist to give you the right exercises to do. Now, so normally during but as a woman, before even your menstruation starts, you must make it a point of duty to engage in exercises, at least 30 minutes of exercises, 3 to 5 times in a week. You can engage in maybe fast walk, we call it brisk walking. Maybe you can do it every day for 30 minutes, or every 3 days, or every 5 days. You can jog, right? You can do mild aerobics like cycling, like swimming, all of this aerobic exercises, they help. And one very powerful thing is that aerobic exercises, they're so powerful because they help to increase your blood circulation. And because your blood circulation is being increased, it helps to release what we call feel good hormones. How many of you want to feel good? If you want to feel good, please type in the chat box, I want to feel good. So I will start doing my exercises regularly. So these feel good hormones are called endorphins. You will say another hormones again. Yes, I told you, as women, our life is what? Hormones. I mean, our second name is supposed to be hormones, actually. Anyways, that's a lighter note. So this can all work together, right, to suit our body, to improve our mood, to reduce headaches, to relieve pains, to make us more relaxed. And then we have the pelvic floor exercises. Remember, I told you, um, 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 menstruation or menstrual disorders have actually impact also on your floor, right? So on a very good day, we're going to talk about our pelvic floor because it's a very, very important aspect, and we as women are supposed to have a good understanding of what our pelvic floor is, how they function, when to know what is normal, what is not normal, and what to do when we notice those conditions. So when you talk with a physiotherapist, be able to know, oh, are you having a pelvic floor dysfunction, and then give you appropriate rehabilitation interventions that is streamlined, unique to you and to your problem, right? So um what's it called? We also have like women who has PCOS, and endometriosis, which I talked about earlier. Most of them actually have tight pelvic floor. So you see, that's why it's important, right? To speak with your physiotherapist, because you will be able to know, okay, does this person have a tight pelvic floor? Does he have a big pelvic floor? And know, okay, are we strengthening it? So normally when your pelvic floor is tight, the exercises we give are relaxation what exercises, but you don't know those relaxation exercises, so you have to speak with your therapist. Then when the pelvic floor is weak, you need to what strengthen the pelvic floor muscles, and that's why it's very important to actually give exercises related to that. We also have other exercises like the mirror biofeedback, where we use mirror to visualize our pelvic contractions and relaxation, use of vaginal dilators. Vaginal dilators are not just sex tools. They are very good for rehabilitation, for pelvic floor rehabilitation. So it's very useful. And then we have Kegel exercises, we have soft tissue mobilization exercises where your therapist can use hands or techniques to actually what break the adhesions, break the um some of the spasms that are around those areas. So it's very important to speak with your physiotherapist. So as we conclude tonight's discussion, you can see that menstrual disorders should never be a source of stigma or silence to you as a woman. For as long as, yes, society may have tagged these conversations as shameful, as leaving women to suffer in silence. That does not exist. That was before. But the new era is that women should be able to speak, seek help when you need to. And that's why I've provided a safe space at Her Wellbeing and Care where women are free to actually talk about anything, I mean anything that affects their physical health, their pelvic health, and their obstetric health. And then I'm there to provide, that solution that they need. And if it's beyond my professional jurisdiction, I refer you to the appropriate professional that will be of help to you. So this is not the era to be silenced. This is not the era to feel ashamed or feel fearful. And be careful what you consume in the internet, because what you consume on the internet also has a way of shaping your um um your your attitude towards seeking the right care. So ensure you speak to a professional, go to the hospital, right? After seeking the first, still go to a professional, speak to them directly so that you can get the appropriate care you need and not over. Sometimes when you go to when you read about some certain things, you might see it so complex, the medical jargons and what have you that you've read, be like, wow, this thing is such a big deal. And by the time you go to a professional, it's so simplified for you and you understand exactly what's going on and you get the right help that you need. So I like to say that early intervention can make the big difference. Please, when you notice any symptoms, right, that is not okay, you notice your menstruation was normal, it stopped being normal, you notice your menstruation is very heavy, you notice that your cycle length has changed, you're having irregular cycle, please seek help as soon as possible. And pelvic and obstetric health physiotherapists like myself are trained to actually help you manage these conditions that relate to your menstrual disorders, to help you improve the quality of your life and to support your journey to a better health as a woman. I hope that you've been able to learn something. And in the few minutes that we have, I'm going to be taking questions, right? Going to be taking questions. I'll stop sharing my screen now. And if you have a question, I'll just like you to type it in the chat box and I'll be responding to your questions. Thank you for listening. All right. So sharing my screen now. Okay. Awesome. All right. So if you have any question, I'll be taking your questions now. Thank you. Thank you for being here. Happy to be here. Yes, I'm happy to have you. Thank you so much. If you have any question, type it in the chat box. Okay. All right. Okay. Awesome. All right. Thank you so much. If you have any questions, you can still drop them in the comments and I'll definitely attend to your questions as soon as I see them. Thank you so much for having me tonight. It's always a pleasure to always speak with you. As a woman, always take your health, very seriously. Don't trivialize things. Early symptoms, early care, early intervention is gold standard, right? The earlier you get help, the earlier you actually get better, the earlier you get solutions to your problems. All right. Once again, if you're meeting me for the first time, I am Dr. Shamsia, and some people call me Dr. Shams. I'm a women pelvic and obstetric health physiotherapist, and I help women to actually experience, I solve problems that help to, enhance women's pelvic obstetric and health issues. So from hormonal problems, reproductive health issues, to your pelvic floor issues, to pregnancy preparation, to postpartum recovery, to sexual related issues. I help women to solve those problems. And if you have any problem, you can as well reach out to me. Thank you so much for having me on this live session tonight, and it's such a pleasure speaking to you all. Thank you, and do have a great day. And don't forget to subscribe to our YouTube channel so that you don't miss out on any of our live sessions or any of our educative webinars and programs. Thank you so much, and see you. Bye. Do have a weekend, everyone. Do have a lovely weekend, everyone. And see you in our next session. Bye.